Welcome back to On the Record. So I know that, we're talking about a lot of the, I guess, concerns that people were having as far as like the first wave, second wave. Is there going to be a third wave, fourth wave, fifth wave, and what is that going to be? But more so, I think that people are, I guess, are a little concerned, again, is with that contact. But should people, go for a flu-like symptom that maybe, you just said that possibly, or consider the flu as H1N1, but should everybody rush to the hospital when they're...
The Montreal Children's Hospital and St. Justine, their emergency rooms are overcrowded by parents who are worried, and I don't blame parents for being worried. However, parents have to remember that this is like any other flu their child may have had in the past years. There was a self-care guide. I believe that everyone should have received a copy by now. If not, there are extra copies at the KSCS. We have a stand there with information on H1N1. We have extra copies at the hospital. And in the self-care guide, it kind of explains a little bit about the flu, and it kind of explains what to do if you have the flu, what to do if your child has the flu, how to protect yourself and each other from transmitting the flu. And there are rare times when you should actually go to see a doctor. We know that pregnant women are high-risk groups. So if pregnant women do come down with the flu, we want to see them because we want to treat them early in their in their flu illness. If we see a child under the age of 2, that child should be seen for an assessment. What I'm hearing through the grapevine is that oftentimes children that present to the Children's Hospital are not being treated for it either. So if they're not presenting any worrisome symptoms, they're already day 3 and they have no fever, well, they're already on the mend. The people we want to see are people who have a chronic illness. So if they're diabetic, if they have asthma, if they have chronic liver or kidney disease, they may be more at risk for complications, and they should seek to come to the hospital. If people are unsure, they're not 100% sure if they need to go to the hospital or not. You can call Info Santé at 811, and they will give you very good advice. They have a decision chart that will also help to guide patients of where they need to go. At the Kateri Hospital, we have an information line, which is 450-638-4112. And there you can leave a message and someone will get back to you within a 24-hour period. Or you can ask to speak to the clinic nurse, and the clinic nurse will judge over the phone if that person or child needs to be seen. At the back of this self-care guide, there is something called a decision chart. And the decision chart has colors. So you have your green, your yellow, your orange, and your red. And so the orange is when you're going to want to consider seeing a doctor within a 24-hour period. The red means, well, you know what, you're pretty sick, you need to go to the emergency room. And pretty sick means a child who has a very high fever, who is listless, who is not drinking, who is not active, someone who all of a sudden is having trouble breathing, is complaining of being short of breath, they have any blueness of their lips, if they seem to be in respiratory distress, obviously those persons need to be seen in the emergency rooms. What will be developed over the next week or so is there are going to be established flu clinics within the region. So I don't have that information today, but there will be probably 3 different centers close by where will be dedicated to seeing patients who have flu-like illness, who think they need to see a doctor, and they will be seen by a nurse, and if necessary, they'll be seen by a physician. And so the nurse will review their symptoms, go through their risk factors, and will either recommend that they go home and drink fluids, take Tylenol or Advil, etc. So that information will be coming down the pipeline. It's being organized with the frontline workers, the physicians that are in the region. At Kateri, we're trying to accommodate the calls that are coming in. So if patients are calling in and they call up the nurse, we're trying to fit them in. And we may actually start cutting back or canceling some booked appointments to accommodate patients that we feel that need to be seen. So so I think the common information, though, that I want to get across, the point I want to get across is it's just the flu. And for a very few number of people who will get very ill, there are certain warning signs and symptoms that you need to be mindful of. But for the great majority of people who get the flu, they will get through it and they're going to survive and they're going to be fine. And most people get through it. It seems to be a relatively mild flu, lasting a few days. but we tell people to stay home because they can continue to shed virus up to 7 days.
And I want to talk a little bit more about the isolation or the incubation periods, and we'll do that right after this quick break.